Good morning, everyone. We'll begin today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. This morning, we are joined by Leslie Waller, epidemiologist at the Metro Public Health Department, and Marilyn Dubree, Chief Nursing Officer at Vanderbilt University Medical Center. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. I want to thank everyone who's helped us successfully start phase one of our roadmap for reopening Nashville. Local business owners who have taken precautions to protect their staff and customers, residents who are continuing to practice social distancing and wear face coverings when out in public, and of course, our local workers who are helping restart Nashville's economy and safely restore our city's vibrancy as we learn to live with the coronavirus. Yesterday marked day one of phase one of our roadmap, a journey that we must take as a community with a coordinated effort. As the proverb says, if you want to go fast, go alone, but if you want to go far, go together. Now, for a sustained economic reopening, we must remain united in our vigilance to slow the spread of COVID-19. We've already made significant progress to save lives and to support our frontline healthcare workers. But let's continue to practice social distancing, wear face coverings as we patronize responsible businesses, and be mindful of all necessary public health measures to keep ourselves and each other safe. Now, the COVID-19 infection rate among local healthcare workers in Davidson County is roughly 6%. Now, the International Council of Nurses has also recently announced that 6% of COVID-19 cases worldwide are among healthcare professionals. Along with first responders, our nurses and other healthcare workers willingly place themselves at the highest levels of risk, all in the name of public health. Nashville is the home to over 11,000 registered nurses and 2,000 advanced practice registered nurses who play such a vital role in providing healthcare to our patients and our community. And today, on International Nurses Day, I want to express my profound gratitude to every nurse in Davidson County who is working tirelessly on the front lines of our coronavirus response. This year's International Nurses Day celebrates our everyday healthcare heroes. On the 200th birthday of Florence Nightingale, one of the pioneers of modern-day medicine, who once said to be a fellow worker with God is the highest aspiration of which he can conceive man is capable of. Now, we are fortunate for each and every one of the nurses in our community who aspire to such greatness and for their dedication to healing and saving lives. This morning, I'd like to welcome Marilyn Dupree, Chief Nursing Officer at Vanderbilt University Medical Center, who is here to help us celebrate International Nurses Day and discuss the good work of our frontline healthcare professionals in the fight against COVID-19. Also with us this morning is Leslie Waller, epidemiologist at the Metro Public Health Department, who will present the Metro COVID-19 heat map and provide an update on the contact tracing investigations and our city's effort to address hotspots across Davidson County. As a reminder, you can visit Metro's COVID-19 website to review Public Health Orders number 4 and 5, which are currently in effect and require all employers to perform staff health screenings, all workers on the job to wear face coverings, and businesses to post signs reminding customers to wear face coverings, among other public health measures. The toolkit for business on Metro's COVID-19 website features helpful educational resources for employers, including details on sanitization procedures, employee health screening guidelines, and more at covid19.nashville.gov. Metro's COVID-19 hotline is available weekdays from 7 a.m. to 7 p.m. at 615-862-7777. And Metro's community assessment centers are open 5 days a week, Monday through Friday, from 9 a.m. to 3 p.m. And remember, all services through the community assessment system, including COVID-19 tests, are free of charge to all Davidson County residents. I urge everyone to visit Metro's COVID-19 website, where you can contribute to the COVID-19 Response Fund or learn how to obtain direct financial food, mental health, and social service assistance. And now I'll turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We had 2 deaths as a result of the virus yesterday, a 54-year-old man and an 84-year-old female. Both had underlying health conditions. My sincere sympathy goes out to their families and friends. This now is the 37th death from this virus in our community. We have confirmed 3,785 cases. That's an increase of 86 cases in the last 24 hours. 1,464 of those cases are active, and 2,284 residents have recovered and are now cleared from the disease. As the mayor noted, phase 1 of our reopening plan started yesterday. For the past 7 weeks, Nashville was in safer at home. I realize that's a long time, and we are all ready to get reopened soon. But remember, phase 1 is just the start. Since mid-March, the Coronavirus Task Force and our partners have worked up to get ready for phase 1. We expanded the city's testing capabilities. Close to 39,000 Nashvillians have now been tested for this virus, and more than a quarter of those have been tested in our community assessment centers. As Dr. Hildreth reminds us that COVID-19 is an invisible enemy, and the best way to see an invisible enemy is to test for it. Now, we've also expanded our contact tracers. When the pandemic started, our city only had 4 investigators. Today, Metro Public Health has a team of 75 conducting this important work. And by the end of the next week or so, we'll have 50 additional individuals hired to continue this work, raising our number to nearly 125 people. Now, this is vital to identify clusters that may develop so we can contain them from spreading further into our community. We've also worked with our healthcare partners to protect hospital capacity. We're in daily communication with hospitals in our city and monitor capabilities daily. We're very fortunate to live in a city that has world-class healthcare systems. And today, we have the capacity available to see a spike if needed. Our website has also been able to provide information that can direct you to resources. The information is available in 5 languages and is able to extend the reach to all Nashvillians. Go to covid19.nashville.gov for any of this information. As the mayor said, we also have our community assessment hotlines, which have to date fielded 10,000 calls. It's staffed 7 days a week from 7 a.m. to 7 p.m., and you can call and have a medical professional ask your questions and help you determine if you need to be assessed further. With our media partners, we've launched an ad campaign to inform Nashvillians through TV and radio and billboards. All of this has been done with the purpose of getting our city ready for the phase we are in currently. And every step of the way, you've been able to help us get there. You stayed at home, you wore face coverings, you've looked after your friends and neighbors, and you've done a great job in helping us flatten the curve. And that has allowed us to enter phase 1. And so we need you to keep focused and keep doing what you're doing to allow us to proceed to the other phases. Please do everything you can to be in here together, and I appreciate all of you done, so let's keep it up. So now I would also like to introduce Ms. Leslie Waller from the Metro Department of Health. Thank you.
Good morning. First, I want to say congratulations to everyone. While phase 1 of reopening isn't so much a celebration, it is quite a milestone. It's one we've all awaited, with or without patience, and one for which many of our neighbors have sacrificed a lot. Now is the time for measured and careful action on everyone's part. As our public health investigation team continues to see clusters of cases around the city that range in size from small to very large, I want to remind everyone that whether you like it or not, you are part of this community. As we all begin to readjust to a more public life, please consider your contacts so we can succeed in finding balance and enact a holistic approach to mitigating the spread of COVID. If you look at the map this week, you'll see that it looks a bit different. That's to be expected. especially as our local experience of this pandemic ebbs and flows. By this point, most of you know that we recently had a large cluster of cases in our homeless and unstably housed population that was centered around the Rescue Mission, an organization that is a great service to this city. We've also been monitoring a growing number of cases in the northeastern part of the county, in addition to our ongoing hotspots. It bears repeating that COVID is impacting workers in industries ranging from warehousing to manufacturing to construction, and it is disproportionately impacting the workers who do not have the luxuries of an office job or the option to work from home. Our team at the health department continues to grow, and we're working every day with managers, superintendents, and cases themselves to find solutions and partnerships that address these inequities. There are some communities that are bearing the brunt of infections right now, and they often work in the industries I mentioned. And yes, there are many cases linked to household spread too, as previously mentioned. In fact, the health department's heat map that you can find on our public dashboard spatially correlates with households where there are a high number of positive cases per home. This is important in our broader response beyond cluster investigation and compounds the equity issue that we've seen arise from the COVID pandemic. As we reopen, I can't stress enough the importance of keeping our clusters in check. More clusters will happen, and if it does at your business, please don't worry. You won't be the first, and you're probably not going to be the last, and our team at the health department will guide you through the response and recovery process. Notify us as soon as your business or other setting has a case. We will work with you on infection control and action steps. We will need active participation on the part of everyone during this era where humanity learns to live with a new pathogen that is both as infectious and potentially deadly as COVID. My takeaway messages this morning are: please do not touch your face, and this includes regularly touching, adjusting, pushing, and tugging on your face mask. Please wash your hands with soap and water. Sanitize if you don't have a sink nearby. I know this isn't necessarily the cool thing to talk about, but it's been repeated for decades because it works. Social distancing and avoiding crowding is key. Don't invade personal space as a courtesy to yourself and others. And finally, wear a mask if it's appropriate for you in your current setting, like if you can't provide adequate distancing between yourself and others at times when you're doing more than just passing by. By considering our contacts, we can protect ourselves, but also our friends, family, and coworkers. So, cheers, Nashville, to a tempered week of reopening and reintroductions. If we're prudent and considerate, our city can mitigate the spread of COVID while regaining some normalcy. And now I would like to introduce Marilyn Dubree, Chief Nursing Officer at Vanderbilt University Medical Center.
Good morning. Thank you, Leslie. Thank you, Mayor Cooper, for establishing this proclamation today honoring nurses of Nashville on May 12th and the lighting tonight of the Korean Bridge and the courthouse in honor of our nurses. 200 years ago, Florence Nightingale was born. She's really known as the modern founder of nursing practice as we know it today. As a clinical nurse, she was one of the first individuals to use data and research to impact the care of individuals, families, and communities. And she is the basis and legacy on which we build our nursing practice today. 2020 has been designated in her honor as the Year of the Nurse and the Midwife. It really has been the Year of the Nurse as we have experienced a pandemic and throughout our country and our world. Throughout our country and our city, nurses have done what they always do. They have cared for individuals, families, and communities. They have accepted the challenge of the COVID pandemic and gone bravely with their healthcare teams into spaces that have shown their competence, their creativity, and their compassion. The generosity and acknowledgement of the Nashville community for nurses and other healthcare team members has been magnificent. The awareness of so many now, more so than ever, the contribution of our nurses is valued by our nursing community and throughout all of our healthcare community. Today and each day, it's our honor as nurses and our privilege to stand in the sacred space with individuals who face some of the most joyful times of their lives and the most tragic. We do that knowing that we are supported by a community that values us and values the health of the individuals who live here. We hope to support those individuals as they recover and ease their pain and suffering if that is not the case. Thank you all for your acknowledgement of the service of these nurses, and thank you, Mayor Cooper.
Thank you, Ms. Dubree. We will now start the Q&A segment of today's briefing. As I announce your name, you may proceed by asking your question over the air. We'll start with Jeremy Finley at WSMV. Jeremy?
Good morning, everyone. Thanks for taking our questions. I wanted to inquire about the enforcement after the first day. I wanted to see if any fines or how many businesses were visited that may have been in violations of the city's orders. I wanted to get the specifics on that if we could. And the second question is for the mayor. I wanted to get his take on the school board's proposal now to close the schools. It's been in the works for a little bit, but they announced they're going to discuss that. I know it's been a long-standing plan, but I wanted to get his take on the closure of those schools and if he has concerns about those schools having to close. Thank you.
Thank you, Jeremy. We'll start with Dr. Caldwell.
Good morning. After our first day, we're in an educational phase and an assessment phase. We are trying to direct everybody to the Nashville hub or the covid19.nashville.gov website so that they can understand what the first phase is, what the orders are, as well as take advantage of all of the resources there for particular establishments. We are cataloging the complaints we're getting, and we're starting with a simple phone call to these locations to speak with the managers to assure that they are fully informed of what's expected of them. Over the next week, we will be ramping up our flow of enforcement to assure that those people that we get persistent complaints from and that we go out to and are not following the rules, we will ramp up enforcement. So this week is just one for us to make sure that we remind each other to wear the masks, make sure that we feel safe going out, and to do an assessment. Thank you.
Thank you, Jeremy. I'm going to be listening in with great interest as the proposal to the school board, I suppose, is presented. Your information on that may be better than mine. I'm also going to be listening in on another subject, which is what our school system is going to need to reopen safely. And that's going to be a challenge for our community that we're committed to get done and get done right also. So there, as always, the school board has a lot of difficult and very important issues to discuss. And the reopening is also an important point that I want them to really, as I know they will be, start focusing on.
Julia Palazzo, WKRN. Julia?
Good morning. Thank you. A few questions. Dr. Jahangir, can you talk more about the types of underlying health conditions that seem to be involved in the deaths you're reporting? And if you know the current number of people hospitalized and how many are from surrounding counties? And then a question for Ms. Waller. You mentioned you're monitoring a cluster of cases in the northeastern part of Davidson County. Can you talk more about that? Is this related to a workplace? Are there multiple clusters? Thank you so much.
Thank you. Dr. Jahangir?
Thank you. The comorbidities range across the board. So everything from hypertension, high blood pressure, obesity, kidney issues, pulmonary issues. There literally is not one specific, there's not an increased incidence of one comorbidity that makes you have a higher risk. It really is just poor overall health in any of those comorbidities. Regarding hospitalizations, the exact number, it slipped me, but it's in the 80s to 90 range for all Davidson County hospitals. And people who are residents of anywhere, because we have many great medical systems here, and so there really is people from the region come here for care. The hospital capacity, though, as I've always said, is the critical point. And this morning, our hospital capacity in Middle Tennessee is 32% of hospital beds are open, and 28% of ICU beds are open. So hospital capacity is the metric that I am extremely careful of as we talk about capacity. Thank you, and I believe Ms. Waller. Thank you.
Hi there. Yep, we do have an emerging geographic cluster of cases in the northeastern part of the county, and they're not linked to one particular place of business or anything like that, but there are a couple that are of businesses where all of our cases are linked. So it just gets back to what I've said before with certain industries being more highly impacted and household spread being a key factor as well.
Chris Davis at News Channel 5. Chris, you're in the air.
Good morning, everyone. Just to follow up on that last question about the Northeast cluster, is it possible to share which specific businesses are impacted, just so that if there are employees there, they are aware of the situation? I also wanted to know about an update on the homeless population cluster. Have you been able to slow the spread in those communities, and how is contact tracing going so far?
Chris, you broke up at the beginning there. You're asking about businesses in the Northeast cluster?
Correct.
Okay, thank you. Ms. Waller?
We work directly with the cases and the businesses that employ them to notify all necessary close contacts. So if we reach out to you, be ready for our call, and please cooperate. But yeah, we're not releasing specific names at this time, but do know that if you have been impacted, we will certainly reach out to you. In terms of the homeless cluster, we are still actively engaged with all of our partners there at the rescue mission, and with that community in particular. We're still doing monitoring of close contacts, and we are investigating all cases that come from that cluster.
We've addressed all the media questions in the WebEx queue this morning. I'd like to thank Ms. Leslie Waller and Ms. Marilyn Dubree for participating in today's press briefing. The next COVID-19 press briefing will take place on Thursday, May 14th at 9:30 in the morning. A recording of this event will be made available later this afternoon. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.